Welcome to Codes of Conduct, Culture, and Professionalism. We're going to talk about some terminologies related to the profession. We're going to define some of the professionals that are in HIT, define what Code of Conduct means, review the culture in healthcare settings, and describe some proper communication methods used in the healthcare setting. We have the health professional, the patient, the clinician, different types of education and training that they can have. Many professions provide care to the sick and injured when we're talking about the healthcare professional. So this could range from a certified nursing assistant to a medical assistant, a licensed practical nurse or LPN, a registered nurse, which is an RN, an advanced practice nurse or APRN. You may also know them as a family nurse practitioner or a nurse practitioner. There's PAs who are physician's assistants, the physicians themselves, physicians with different specialties. If you remember from our earlier lectures, we talked about primary care physicians and the different areas that the advanced practice nurse and the PAs can work with urgent cares and in private offices. A clinician is defined as any individual that's qualified to work in the clinical practice of medicine. Emergency medical technicians, paramedics, there's just a barrage of people that we can refer to as a clinician. And a patient is anyone who seeks medical services. And some people who have been in medical classes or in nursing classes may know a patient is synonymous with a client. Oftentimes clients are what we refer to in a home health setting or in a nursing home setting. That's simply because they're trying to treat them more of their home and a home environment, and they're asking for particular services that are more generally they're domestic services like housekeeping and food preparation and bathing as related to the more skilled services of IV medication administration and things like that. Education is different for all of them, and even all of you that are in health information technologies, this is part of your education into that realm. You're coming, a lot of you, from an IT type background. Some of you are coming from a clinical background, and we're all meeting in the middle. So education for these individuals consists in formal lectures and activities, which is what you all are attending right now. Simulations and patient contact, any of you that are EMTs or CNAs or in nursing, that's you're practicing on fake patients or in scenario type situations. And depending on that health profession, you may be on the job training, it may be a certificate, it may be varying levels of formal education from a diploma in high school clear up to a doctoral degree. Training is often hands-on in a supervised clinical practice, and even those of you that are looking at this from an information services or information technologies realm, it's going to be hands-on in an environment that deals with health information. So whether that's working in a medical records department as an internship or working as an internship on an IT service desk perhaps within a hospital or clinical setting, those are all hands-on areas that are giving you that increased level of responsibility over time that makes you more hireable and gives you a step up on others. Certification can have several meanings. Some people say that a certified nursing assistant, right, is certified. An EMT might have a certification. I also have an EMT and kind of partial to having a license versus a certification because I'm practicing actually under the doctor's license, my medical director's license, so sometimes certification versus licensure. Certification is increased education or training in a certificate program. So by name, it's called a certificate program. Generally, it's by a national organization. And so I am board certified in informatics. And my board certification comes from the American Nurses College Credentialing Association, which is the ANCC. And it is a national and even international organization. And that is my specialty. So I'm a registered nurse by education with a master's degree, And then I am certified in informatics and in clinical and nursing informatics by a national, international organization. Some states use the certifications as a mechanism for regulated practicing, and so any of you that are emergency medical technicians or know any that are, we are certifications based on the state level. So we're nationally registered with the National Register of Emergency Medical Technicians, but then we also have a state certification, and the state certifies us in different advanced level practices. And so in my case, I have advanced airway, I have IV maintenance and insertion, medications. Those are different certifications above and beyond just being certified as an EMT. The CompTIA Healthcare IT Technician Certificate is another form of a certification that is from the CompTIA, which is nationally recognized and gives you guys that cutting edge. Those of you that are in that have a CompTIA, that gives you one step up when you have that certification in a job interview for the world of health information technologies. Codes of conduct are rules of behavior that a group of people adhere to. And so as a registered nurse, I have a nursing scope and standards book that's by the American Nurses Association, which is, again, a nationally recognized standards of practice that governs what I do as a registered nurse. And it tells me things like non-maleficence, which means I will do no harm to patients. It's not just doing good things for patients, but that I will do no harm, and that's very important, and that's one of those codes of conduct for nursing. Codes of conduct can also be part of a facility or an organization. So a code of conduct might say that you always have to wear your name badge and it has to have your picture on it. A code of conduct may say that you can't wear 5-pocket denim pants. That's a form of a code of conduct. Formality of procedures is jargon-wise a set of established behaviors for collectively achieving a goal. So protocols, checklists, and algorithms. The book gave some examples, and I'll expand upon that. If a person presents with chest pain, there are these 3 or 4, 5, 6 things in this order that you do. A patient presents with chest pain, and it is decided upon in a triage setting that it could very well be true cardiac chest pain, then you immediately take the person to a room, put them on a monitor, establish 2 IVs, hook them up to an EKG within 10 minutes of arrival, et cetera, et cetera, et cetera. There's these certain things that almost a standards of practice is another form that we use for that. Checklists. When you read through the John Hopkins set of slides that I provided for you from a lecture that was given by Dr. Provenos, he talks about forming a checklist, and it's just making sure that you've done this formality of procedures, that you've checked the patient's identity, that you've done a timeout, that you've put your gloves on, that you've washed your hands before you put your gloves on, that you have certain sterile equipment at the bedside and certain antiseptic equipment at the bedside, and you've done all of these things to prevent this bloodstream infection. An algorithm, for those of you that have done any kind of healthcare, and it follows along with workflow. Workflow is a type of algorithm. So it says, if the person presents with this, do this. Did they respond yes or no, then do this. If they responded, do this. If they didn't respond, do this. It's exactly like the workflow diagrams that you presented. Sanitation goes along with these procedural behaviors, so hand washing. It's very important in this case, what I'd like to emphasize in this lecture for those of you that do enter the workforce in a healthcare setting, very much like I've noticed some of you work in food preparation or waitressing, or last year I had students that worked for pizza companies. Just like they always want you to wash your hands in food service, it's the same thing with the hospital, obviously. You have got people that are generally sick. That's why they came to the hospital. They're touching things. You're touching things. You're touching the same things that each other's touching. So hand washing. And they always say, if you sing the alphabet and really rub, friction does more than the soap and the hot water alone. So rub your hands briskly and sing the alphabet. That should do it. But you need to do it often and frequently and use hand sanitizers in between. The rule of thumb is, if you don't have visible debris or visible substances on your hands, that a hand sanitizer with friction is enough. If you have any kind of blood or dirt or garbage on your hands, then you must use soap and water, again with friction, sing the alphabet. Isolation warnings. It's very important to be aware of what this means and what you see. As a health information technologies person, you might be called up to a patient room or to somewhere in the hallway because the system's not working. Potentially, you've got to put in a new network drop, or the network drop isn't functioning and you're coming in to test. It is very appropriate for you to go into the patient's room. You always want to introduce yourself. Maybe you've gotten the nurse first to make sure it's okay you go into the room. Maybe the nurse will come with you or CNA and introduce you to the patient. But you're going to be going in and out of rooms. If you have a patient that has an isolation warning or a fall risk warning, you need to be aware of what that means and know what you're responsible for when you go into that room. You may still have to go into that room, but isolation, there's usually a card outside, and it means gloves, mask, an actual overcoat, like a full-length body substance garment that you would wear before you go into the room, and understand what those rules are, that you're supposed to take it off and leave it in the room before you come back out. Because obviously if you come out of the room with that stuff on, you've carried the germs into the hallway and now you've exposed other people. Procedural and situational awareness is thinking about intimate situations. And I personally have had issues in the past where different nursing staff or EMTs or even physicians, we're used to seeing naked bodies and we really don't think of it. Honestly, I'm not looking at anything personal that you have. This is just the job I do. But unfortunately, this might be the first time that you or that the patient has been exposed, and bright lights and all these people coming and going. Remember that it's important to give a person their privacy. There isn't any reason why a curtain can't be pulled, why you can't have pull up a blanket or a gown to cover whatever it is that's going on with the patient, and be respectful of their privacy. Originally in the emergency department, when we first installed some computers in the actual patient rooms, they were close to the door, and I could actually pull the curtain and work on the computer when I was in the doorway, and therefore I wasn't even where the patient could see me because if I manipulated the computer. So be aware of that, and be aware that it might be uncomfortable to you too, and that's understandable. And so being aware of your own limitations or your own concerns is important. Sensitive situations. It's totally not okay to go into pediatrics or into OB and crack a dead baby joke. There might be a dead baby right there. You might have a family right next to you that has just lost something or had a diagnosis that was bad news. As an x-ray technician or something, you might be very well aware in the ultrasound the baby's not moving, and that's very scary. Or there's not much amniotic fluid when you're doing that ultrasound, and how you represent yourself to the patient and what you do with that type of situation, because you're not the physician to tell them everything's okay or not okay. Diagnosis and bad news. You might be coming into a room to do something with healthcare information technology and trying just to be nice and, hey, how are you? I'm so-and-so, and get an adverse reaction from the person, like, why are you here? You need to leave. And you need to be respectful of that. You have no idea what's just gone on, and it's totally appropriate to say, I'm sorry, and leave the room, and then go find some other staff that can help you understand what it is going on, or tell you when the best time to come back is. Personal and family situations. A lot of times in mother-baby or even in the emergency department, there's domestic situations going on. And it doesn't have to be a bad domestic situation. We're not necessarily talking about, the estranged father and mother situation in OB, but just interesting family dynamics that can happen, and you need to be aware of it and know what doesn't seem right, probably isn't right, and go get someone else if you need help. Social codes of conduct are any kind of conduct that's caused by or affecting others. So what you do that's social behavior. Opening the door for someone is social behavior. Standing up when a woman walks into the room. Anything you think of chivalrous, that's a type of social behavior. And we talked a little bit about those uncomfortable situations in the last slide. So be aware that it's okay. In some instances, you might be shy, or you might be met with somebody that has aggression, and the things that you would do in those situations. Moral and operational, and here's where it gets a little bit gray. Because of operations, there may be times where you're faced with a situation where you have to do things that make you morally uncomfortable, but that's what is decided upon by the organization, and it's because of the way they operate. So in the state of Montana, and governed by the Centers for Medicaid Services, we have EMTALA, which is the Emergency Medical Treatment and Active Labor Act. And what it says is that if a person presents to an emergency department, you have to treat them. You are legally bound to give them a medical screening to determine if it's life-threatening or if they're in active labor. You can't put a person's life or a fetus's life at risk because the person doesn't have the ability to pay. So private for-profit facilities have the ability to refuse service to certain individuals, but if you are nonprofit or if you are participating in Medicare, Medicaid services, you must follow this EMTALA law. And I've got a link there if you'd like to learn more about it. Some other moral and ethical obligations that you might be faced with that are related to operational is there are facilities that perform abortions. You might be working at a specific clinic or specific hospital that performs abortions, and you might have some strong moral opinions about that or personal beliefs. Catholic facilities often do not offer birth control or provide a permanent source of birth control. As rumored, one of the reasons St. Pat's doesn't have babies right now, and I don't have proof for this, so don't quote me, but they wouldn't do tubal ligations and some of those other permanent birth control things that happen during a C-section or when a mother comes in to give birth. And that's one of the reasons they're not delivering babies at the moment, but that doesn't mean that they won't go there. But just know that Catholic facilities, that's another example of a moral obligation that is also part of the operations of that facility. Communication is a big one, and part of your assignment will be for team steps. And I hope you take it really serious. It is becoming a big process or adopted policy, procedure, a code of conduct at many facilities around the nation. But professional communication, there is style and then there is content. And your style is how it's said. And think about the inflection and the tone in your voice. And if somebody said, "Thanks for nothing," that sounds really rude, as opposed to, "Thanks for nothing. That is great." I mean, at the end of my day, I'm thrilled nobody gave me anything. Thanks for nothing. Versus being upset at somebody because they didn't help you out. Thanks for nothing. Content is what is said. So the content flows into what a real message is and the meaning behind the message. And a message requires a sender and a receiver. And so for effective communication, the receiver should understand the message as it was sent. You all hear about the little, there's been, where you sit around the campfire and you tell the story 6 times, and by the time it gets to, one person tells it to one person, and the next person tells it to the next person, by the time it gets to the end, how different the story is than the original story the first person told. So you want to make sure that the receiver gets the same message that was sent. And then I got an example for you here. I put out the office fire. What does that really mean if it's totally out of context? Did you put out a situation that was escalating in your office because of some reason, or did you actually physically put out flames and smoke because something was truly on fire? Communication spills into culture. So in this case study by John Hopkins for the bloodstream infection story, there was a couple quotes I took off of the slides, and the whole point behind this bloodstream infection has to do with a culture of change. And the crux of the story was bloodstream infections were escalating. Thousands of people had died in a year, and no one was really willing to hold anybody accountable for it. And yet, as you'll see, that the Toyota company had a few brake failures that killed some people, and the CEO came out and said, "I'm so sorry." But you just don't hear a physician necessarily coming out with thousands more deaths saying, I screwed up, I didn't wash my hands. I screwed up, I didn't put on my mask. It was just it's changing that whole culture that medicine is a risk that somebody takes when you go into surgery, but it's also the responsibility of the individuals around that patient. And it's the responsibility of everybody. Healthcare is a team. If you recall, we talked about interdisciplinary functions of people. You've got the respiratory therapist and the radiology techs and the certified nursing assistants and the nursing staff and the physical therapists and the speech therapists. It's everybody's responsibility as a team to make sure that the patient is safe and has the best outcome. And so the example from the slides were Dr. Provenos challenged the nursing staff to please, when you notice that the physician has not washed their hands or if they've missed a step on the checklist, you need to call it out before there's harm done to the patient. And the nursing staff is saying, it's not my job to police the docs, and they're going to yell at me. And at the same time, he went to the docs and he said, please recognize that you are not perfect. You're very busy. You are very knowledgeable, but everybody can make a mistake. And please be aware if somebody corrects you, it's simply because they're trying to help you and help the patient. And the docs are saying, there's no way you can have somebody question me. That would make me look stupid. So look through that. It was kind of fascinating what this culture of change and that culture in medicine still exists today, where the physician knows all, and he's in charge, or he or she is in charge, and how that affects the people around them that are just trying to help and do the best they can for the patient, and the different ways they talk to each other, and the different ways the situations unfold. And that's part of what Team Steps will cover. So in summary, we've got different professionals from the healthcare industry to the information technologies industry. They have varying degrees of education and certifications and specialty areas that they have knowledge in. Your code of conduct is a set of behavioral rules for a particular group, usually governed by an organization that oversees that group, whether it's a hospital or whether it's an organization they belong to as a member. Communication is when the received message is the same as the message that was sent, so it's understood. And culture within healthcare and adapting a culture of change. There is a culture, it's archaic, it's moving forward, and how we can adapt a culture of change, because everything that's moving so fast with technology is a lot of change, and we need to figure out how to get over that culture. Thanks.